Hello, I'm Gloria Averbush of Chalk It Up, an informative and thought-provoking look at a variety of contemporary topics and issues. Our guest today is dermatologist Dr. Terrence Keeney, co-founder of Skin DC, a practice located outside of Washington, D.C. Dr. Keeney, your motto is that prevention is always better and easier than correction. Can you elaborate on that and how that plays into what you do?
Yeah. You know, when you think of skin disease, a lot of skin disease, whether skin cancer, aging, wrinkles, hair loss, patients are often presenting, way at the end of the course. These processes have occurred over time. Sun exposure, slow thinning of the hair. These are things that patients wait. And I encourage and I talk and I counsel my patients that, the first sign of any skin disease, and this really applies beyond skin, it's really health in general, earlier intervention is always most important. So I encourage my patients, any sign, any concern they have about their skin, I encourage them to come in, because nowadays we have tools to identify these problems beyond the naked eye that help us identify and initiate treatment early, because early initiation of treatment often leads to better outcomes.
So some of these things clearly aren't visible or known to us. That's part of the problem. It's not until the actual condition exists that we think to treat it. What is the preventive measure that we can take so that we can take advantage of some of these technologies? How do we know what we don't know?
So from a dermatology perspective, it's important for younger patients to see a dermatologist. We're talking teens, 20-year-olds. For example, if we're talking about melanoma, a skin cancer that people are often concerned with, we often have moles at a young age. We can use this imaging technology to image your moles, what we call sometimes mole mapping or dermoscopy, to look at all those moles and get an idea, is there any atypia with any one of those? And if there is, then we can initiate early therapy. So, coming to the dermatologist a little bit more frequently, unfortunately, at a young age, patients do develop problems like acne and whatnot. So, we often initiate some of these discussions about early prevention when they may be coming in for another condition. So, there's cross-education. When someone's coming in for a wart when they're young, we're talking about sun protection and mole tracking. Teenage men, we're talking about hair loss at an early age before the hair loss begins. We're talking and educating our patients about prevention, so then they can be more invested and be a little bit more proactive in their health, their skin health.
So it's relevant to all ages, both genders. The idea that you can prevent with this particularly latest technology is relevant across the board.
Absolutely, absolutely.
Thank you very much for valuable information about prevention, the most important aspect of what we can do as consumers.